Greetings, everyone. For today's lecture, we're going to learn more about the fundamentals of nursing. Unit 1, the nature of nursing. Chapter 1, historical and contemporary nursing practice, and under that is the contemporary nursing practice, in which we will focus on today. This book from Kusher and Erb will be our main reference. An understanding of contemporary nursing practice includes a look at definitions of nursing, recipients of nursing, scope of nursing, settings for nursing practice, nurse practice acts, and the current standards of clinical nursing practice. Let's first define what is nursing. Florence Nightingale defined nursing nearly 150 years ago as the act of utilizing the environment of the patient to assist him in his recovery. Nightingale considered a clean, well-ventilated, and quiet environment essential for recovery. Often considered the first nurse theorist, Nightingale raised the status of nursing through education. Nurses were no longer untrained housekeepers, but people educated in the care of the sick. Virginia Henderson was one of the first modern nurses to define nursing. She wrote, "The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery. That he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible." Like Nightingale, Henderson described nursing in relation to the client and client's environment. Unlike Nightingale, Henderson saw the nurse as concerned with both healthy and ill individuals, acknowledged that nurses interact with clients even when recovery may not be feasible, and mentioned the teaching and advocacy roles of the nurse. In the latter half of the 20th century, a number of nurse theorists developed their own theoretical definitions of nursing. Certain themes are common to many of these definitions. They define that nursing is caring, a helping profession, an art, a science, client-centered, holistic, adaptive, and promotes health, maintenance, and restoration. You can remember the acronym CHASTA for this. Professional nursing associations have also examined nursing and developed their definitions of it. In 1973, the American Nurses Association, or ANA, described nursing practice as direct, goal-oriented, and adaptable to the needs of the individual, the family, and community during health and illness. In 1980, they changed this definition of nursing to this. Nursing is the diagnosis and treatment of human responses to actual or potential health problems. In 1995, they recognized the influence and contribution of the science of caring to nursing philosophy and practice. The current definition of nursing remains unchanged from the 2003 edition of Nursing Social Policy Statement. Nursing is a protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. For the latest definition of nursing according to ANA, you can remember the acronym PAPA. Now, we're going to tackle about the recipients of nursing. Who are these groups of persons or people that receive the services of nurses? We have here three recipients, namely consumer, patient, and client. Sometimes they are used interchangeably because they seem to have the same meaning, but let's define each of these. First is the consumer. A consumer is an individual, a group of people, or a community that uses a service or commodity. People who use healthcare products or services are consumers of healthcare. Next is the patient. A patient is a person who is waiting for or undergoing medical treatment and care. The word patient comes from a Latin word meaning to suffer or to bear. Traditionally, the person receiving healthcare has been called a patient. Usually, people become patients when they seek assistance because of illness or for surgery. Some nurses believe that the word patient implies passive acceptance of the decisions and care of health professionals. Additionally, with the emphasis on health promotion and prevention of illness, many recipients of nursing care are not ill. Moreover, nurses interact with family members and significant others to provide support, information, and comfort in addition to caring for the patient. For these reasons, nurses increasingly refer to recipients of healthcare as clients. Why is that? A client is a person who engages the advice or services of another who is qualified to provide this service. The term client presents the receivers of healthcare as collaborators in the care, that is, as people who are also responsible for their own health. Thus, the health status of a client is a responsibility of the individual in collaboration with the health professionals. That's why client is a preferred term, although consumer and patient are used in some instances. So remember, consumer are those who uses, patient are those who undergoes, and the client are the collaborators. Now, what are the scope of nursing? Nurses provide care for three types of clients, like the individuals, families, and communities. Nursing practice involves four areas, such as promoting health and wellness, preventing illness, restoring health, and caring for the dying. When health is defined broadly as actualization of human potential, it has been called wellness. Wellness is a process that engages in activities or behaviors that enhance quality of life and maximize personal potential. Nurses promote wellness in clients who are both healthy and ill. This may involve individual and community activities to enhance healthy lifestyles, such as improving nutrition and physical fitness, preventing drug and alcohol misuse, restricting smoking, and preventing accidents and injury in the home and workplace. Next, on preventing illness. The goal of illness prevention programs is to maintain optimal health by preventing disease. Nursing activities that prevent illness include prenatal and infant care, immunizations, and prevention of sexually transmitted infections. In restoring health, it focuses on the ill client and it extends from early detection of disease through helping the client during the recovery period. Nursing activities include the following: providing direct care to the ill person, such as administering medications, baths, and specific procedures and treatments. Also, performing diagnostic and assessment procedures, such as measuring blood pressure and examining feces for occult blood. Next is consulting with other healthcare professionals about client problems. Also, teaching clients about recovery after a stroke. And lastly, rehabilitating clients to their optimal functional level following physical or mental illness, injury, or chemical addiction. And lastly, are caring for the dying. This area of nursing practice involves comforting and caring for people of all ages who are dying. It includes helping clients live as comfortably as possible until death and helping support persons cope with death. Nurses carrying out these activities work in homes, hospitals, and extended care facilities. Some agencies, called hospices, are specifically designed for this purpose. Generally speaking, in promoting health and wellness, these are the group of people that don't have risk for a certain disease and currently are not experiencing disease and is not undergoing treatment. In preventing illness, these are those who are not yet sick but at risk for acquiring certain diseases. They are still able to perform their activities of daily living without difficulty. Hence, we need to prevent those by maintaining their optimal health. In restoring health, unfortunately, you are already sick in here, and you have certain difficulty to perform your activities of daily living. And so we help as nurses to detect the disease and during the recovery. And unfortunately, sometimes current treatment doesn't seem to be effective anymore, such as in terminally ill clients. However, they are still alive. We need to ensure that they live as comfortable as possible. Now, we're going to tackle about the different settings for nursing, or those places or agencies where nurses practice their profession. In the past, the acute care hospital was the main practice setting open to most nurses. Today, many nurses work in hospitals, but increasingly, they work in clients' homes, community agencies, ambulatory clinics, long-term care facilities, health maintenance organizations or HMOs, and nursing practice centers. Nurses have different degrees of nursing autonomy and nursing responsibility in the various settings. They may provide direct care, teach clients and support persons, serve as nursing advocates and agents of change, and help determine health policies affecting consumers in the community and in hospitals. Next, we'll discuss about the Nurse Practice Act. Nurse Practice Acts are legal acts for professional nursing practice, regulate the practice of nursing in the United States, with each state having its own act. So each state have their own Nurse Practice Acts. All the Nurse Practice Acts differ in various jurisdictions. They all have a common purpose. What is that? To protect the public. Nurses are responsible for knowing their state's Nurse Practice Act as it governs their practice. Now, here is a simple version of how you can understand Nurse Practice Act with regards to the nursing profession. Remember that each state has their own board of nursing that regulates the Nurse Practice Act. Every board of nursing is a member of NCSPN, or the National Council of State Boards of Nursing. And NCSPN supports the Nurse Licensure Compact. We discussed about the Nurse Licensure Compact on the nursing education, and this is how it will affect the Nurse Practice Act. Okay, here I'll show you a diagram of how this goes. Every state and territory in the U.S. set laws to govern the practice of nursing. These laws are defined in the Nursing Practice Act. The NPA is then interpreted into regulations by each state and territorial nursing board with the authority to regulate the practice of nursing care and the power to enforce the laws, or the boards of nursing. 50 states, District of Columbia, and 4 United States territories have state board of nursing that are responsible for regulating their individual nurse practice acts. The boards enforce these laws as defined by their respective state or territorial legislative bodies. The legislative body gives the Board of Nursing the power to discipline nurses who violate the nursing laws and regulations. Only the BON has the power to discipline a nurse who may pose a danger to the public. Most states and territories have one nursing board regulating all levels of nursing, including practical nurse or vocational nurse, registered nurse, and advanced practice nurses. Some states, such as California, Nebraska, West Virginia, and Louisiana, have separate state boards for these practices. These boards are all members of the National Council State Boards of Nursing, or NCSBN. The National Council of State Boards of Nursing promotes evidence-based regulatory excellence for patient safety in nursing care and public protection. The NCSBN has supported the Nurse Licensure Compact with 39 state boards of nursing recognizing a single nursing license to practice in multiple states. However, nurses are held accountable to the specific state NPA at the location of their nursing practice. In other words, you are only accountable to the NPA of the state you are currently working in, regardless of where you have originally passed your NCLEX. Now, we'll discuss about the different standards of nursing practice and professional performance. Let's divide them into two: nursing practice and professional performance. Establishing and implementing standards of practice are the major functions of a professional organization. And for nurses, this is the ANA, or the American Nurses Association. The purpose of the ANA Standards of Practice is to describe the responsibilities for which nurses are accountable. The ANA develops standards of nursing practice that are generic in nature by using the nursing process as a foundation, and provide for the practice of nursing regardless of area of specialization. Various specialty nursing organizations have further developed specific standards of nursing practice for their area. So what are these? Includes assessment, diagnosis, outcomes identification, planning, implementation including coordination of care, and health teaching and health promotion. And lastly is the evaluation. So you can see this is the nursing process, and the nursing process are our responsibilities in nursing practice. Remember ADOPI for nursing practice. This is formerly as ADPI, but now they included outcomes identification. That's why it's now ADOPI. Now, for the professional performance. The ANA standards of professional performance describe behaviors expected in the professional nursing role. Generally, this also applies to all the other professions, but we focus on what's also effective in nursing. It includes ethics, culturally congruent practice, communication, collaboration, leadership, education, evidence-based practice and research, quality of practice, professional practice evaluation, resource utilization, and environmental health. All in all, we have 17 standards for our practice. And to remember these, you can remember the acronym Coco Cutie is a creep. Coco Cutie is like a name of a person, and this is a creep. COCO stands for Communication and Collaboration, Q for Quality of Practice, L for Leadership, E for Ethics, another E for Education, and for the creep, C For culturally congruent practice, R for resource utilization, E for EBP and research, and last E is environmental health. And don't forget letter P is a professional practice evaluation. If you wanted to easily remember this, those that are not in nursing practice, such as the ADUPI, are included in professional performance. Now, here is the actual publication that ANA released regarding these standards of practice. You can access it on their website. Includes here is entitled Announcing ANA's Nursing Scope and Standards of Practice 3rd edition. They define nursing, caring, with the who, what, why, when, where, and how of nursing. And on the next page, here are the standards of nursing, the standards of practice, which are the ADOPI, and the standards of professional performance. The new addition to these standards are the culturally congruent practice. By adding the standard 8, the nursing profession recognizes the need to address culture as an essential part of planning and providing care. They also have here a call for all registered nurses to action to raise the bar by reading Nursing Scope of Standards of Practice, the 3rd edition, assessing the document and contemplating what it means to you in your practice, integrating the scope and standards into practice by developing culturally congruent care in every situation and setting, sharing the word and encouraging other nurses to integrate the scope and standards into practice, and excelling in using knowledge and conducting and applying research to achieve the highest quality of evidence-based care. And here is the when, where, and how of nursing. And you can get your own copy of the publication on their website. Okay, so as a summary, we discussed about contemporary nursing practice. First, we defined nursing. According to Nightingale, it is the act of utilizing the environment. According to Henderson, it is the caring for the healthy and the sick individuals and assisting them in their recovery. And also, CHASTRA is the acronym for the concepts of definition from various nursing theories. C for caring, H for helping profession, A and art, S science, another C for client-centered, H for holistic, A for adaptive, and H for health promotion, maintenance, and restoration. And according to ANA or American Association, nursing stands for PAPA. It stands for P for protection of health, A for alleviation of suffering, another P for prevention of illness, and A for advocating for care of the population. We also discussed about the different recipients of nursing, the consumer, patient, and clients. The consumer are those that uses the health services, patient are those undergoes treatment and recovery, and the clients are those who collaborates with the healthcare professionals. Next, we discuss also about the scope of nursing, including promoting health and wellness, preventing illness such as by PIP or prenatal care, I for immunizations, P for prevention of sexually transmitted infection. And next is the restoring of health and caring for the dying. We also discussed about the different settings of nursing such as hospital, home, community, clinic, long-term care facilities, HMOs, nursing practice centers. Next is the Nurse Practice Acts, which regulates the nursing profession in order to protect the public. Here is the diagram. Let me enlarge it a little bit. Okay, so remember, each state has their own Board of Nursing that regulates the Nurse Practice Acts. Every Board of Nursing is a member of the National Council States Board of Nursing, and NCSBN supports the Nurse Licensure Compact. And lastly, we discussed about the different standards of nursing practice and professional performance according to ANA. And nursing practice stands for ADOPI, which means assessment, diagnosis, outcomes, identification, planning, implementation, and evaluation. And the rest are included in professional performance. Next, we're going to discuss about the roles and functions of the nurse. Okay, thanks for watching.